Hey everyone, welcome to the Catch-Up. It is flu season. It is said that 20% of Americans will suffer from the flu this year alone. We spoke to Dr. Erik Tavarez from Tavarez Family Clinic to give us some tips on prevention.
So one of the things that we have right now is we have the situation with people coming into the hospital or to the doctor's offices with symptoms of flu-like symptoms, common cold. When to go to the doctor, when to go to the ER, that's a big dilemma. Most common symptom that they're going to have, runny nose, maybe some cough, body aches, chills, general malaise. But fever is very important. If we don't have fever, most likely we don't have a viral infection. At that point, we want to go ahead and have the patient be seen. In the doctor's office, it's very basic. We're going to test for the important things: influenza A, influenza B, and of course, we're going to check if you have sore throat, we check for strep. That doesn't mean that those are the only ones that we have available to us. There are other viruses, yet they're not as problematic for us physicians. So for the patients, what we want to do is very simple. If you have these symptoms, we know that it's a viral infection that's going to have a longevity of 3 to 5 days. But we test because we want to make sure we are avoiding the important ones such as influenza A or B, which may wind up with a viral pneumonia, and that's when it gets more dangerous for us. Treatments. Treatments are very important. So treatments, common home remedies are very important. Cough syrup, and analgesics, medications for fever, those work great. Fluids, great. Vitamin C, questionable, but encouraged. Antivirals. Antivirals are limited only for influenza A and B and are not of much benefit to regular common cold. So if you're at home, you want to decide going to the doctor, and you have these symptoms, after you get tested and you're negative, does not mean you don't have an illness. Doesn't just means you don't have an illness that requires any kind of severe treatment or more important treatment. For those patients, the common remedies work well. Little kids, they're going to have the runny nose, so we're going to do, maybe we do an antihistamine. Those work great. Avoid contact with other people that may have it, which will go into the prevention. So the prevention is very simple. Wash your hands. If you wash your hands, less chance of getting it. Number 2, wash your hands. That's going to help, okay? If you are sick, don't hang out with your friends. Be by yourself 3-4 days and you're not going to be contagious anymore.
So there you go, everyone. Wash your hands, and get the flu shot. Join us next time. For now, make sure you follow us, turn on those notifications, follow us on Instagram and Facebook. See you soon.